Hello, hello, welcome back to everyone. This is Uta here from Trans Widow Uta Hagen YouTube channel and utahagen.substack.com. Now, this is all very interesting. You can find the 6 hours of testimony about, I like this phrase, the transgender treatment industry at the government website of the Federal Trade Commission, ftc.gov/danger-gender-affirming-care-minors. And I think there's a dash in between every single one of those. You can find that link on the posts here. Now, this is part one of a several-part series on simply the testimony of Navy captain and now retired reconstructive plastic surgeon. And it is important to note that there are two areas of plastic surgery. There is reconstructive plastic surgery, which restores form and function to body parts that have been damaged or where something was wrong. And the opposite of that, which is patient-selected cosmetic surgery, such as breast implants, nose jobs. I guess there are people who do surgeries to get rid of their wrinkles. I will never do that, I promise you. Okay. So he testified before the Federal Trade Commission, part of a 6-hour day of testimonies from detransitioners, whistleblowers, and doctors like Dr. Patrick Laffert. I might have said the name wrong at first. It's Laffert, Lappert. Okay. It's his testimony is in that 6-hour what do you call it, epic, at about 3 hours and 24 minutes. I spent many hours transcribing this, and I really wish that the Federal Trade Commission would put out transcriptions. I think most of the people had, their testimony written up. It's all very important. Okay. And also you can find it in written form in a few days at utahagen.substack.com. So now it's important when we're discussing all of these matters to know what some of the acronyms are. SOCs is Standards of Care, and WPATH is this organization composed of the practitioners of trans ideology and individuals who believe that their body needs to be corrected to be in partnership with their opposite sex mind. Okay, that's WPATH, World Professional Association for Transgender Health. And it was cited that the current president of WPATH is still Marcy Mark Bowers. I am not sure. That is the famed surgeon who operated on television for the show I Am Jazz. Okay, so this is part one of my transcription of what he said. The transgender treatment industry actually operates in the American medical system through the use of deceptive labeling and deceptive practices to present gender affirmation care as grounded in science. It claims that gender discordance is lethal if not treated with gender affirmation care. It claims that gender affirmation, meaning hormones, this is my adding it, meaning hormones and surgeries, is life-saving. It claims that gender affirmation is medically necessary and that it improves the lives of self-identified children. It claims that affirmation care is founded in an accurate process of diagnosis. It claims that affirmation care is the standard of care and that all of this is based on an unassailable body of evidence. All of these claims are deceptive and are made in support of medical and surgical treatments that produce severe and lifelong harms. It mislabels gender affirmation as reconstructive rather than cosmetic, using that deceptive labeling to defraud public and private insurance programs, as well as defrauding the finances of families while essentially medicalizing these young people. And I will even say that I believe I, a trans widow with a husband who was spending all the family money on these treatments, I was also financially defrauded because he was doing that all in a deceptive and secret way. Virtually all, now Dr. Laffert continues, virtually all of the publications of the transgender treatment industry, from journal publications to gender clinic websites, are legal declarations which refer to the WPATH standards of care as the foundational document that serves as scientific basis for gender affirmation, including surgery. This document was produced allegedly using the Delphi consensus methodology. One of the criteria for competently done Delphi assessment is that it's done by repeated voting processes that include members outside of the organization that's doing the questioning, and that the voting is done anonymously. So this is setting up care guidelines called standards of care. This is Uta talking now. In cases where scientific studies cannot be ethically done or have not been done. And so what they do is they gather all the anecdotal stories from the practitioners, from the doctors, and the doctors are supposed to have voting on whether they agree with this guideline from doctors who are outside of that organization, who are asking the questions about this, as well as the doctors inside the organization. Now, this is very interesting to me because I watched and transcribed the crazy discussion, argument, whatever you want to call it, between a trans-identified man, Brianna Wu, and a trans-identified man, Dr. Marcy Mark Bowers, where Marcy Mark Bowers was saying, after Wu said, there haven't been studies, we don't have the evidence, Bowers said, but we did the Delphi consensus method. And I didn't know about what the details of what that meant, and that it actually is a codified method of guideline approval, which is done very carefully, trying to present the best possible outcomes for the patients and the best possible advice for those doctors. Whereas we know that WPATH, the World Professional Association for Transgender Health is completely infiltrated with men who call themselves women, who have a political and personal agenda, who are not going to engage in a neutral discussion about these practices, because they've had the operations and they need to self-justify by saying that even teenagers need these operations. Okay, so let me just repeat what Dr. Laffert said. This document was produced allegedly using the Delphi consensus methodology. One of the criteria for competently done Delphi assessment is that it's done by repeated voting processes that include members outside of the organization that's doing the questioning, and that the voting is done anonymously. None of this is the case for the standards of care that WPATH published, which is called SOC 8, their 8th version. Okay, so now my commentary. WPATH is trying to establish rules about how to treat children with confusion in their sex, except WPATH has invented gender and created educational companies to go into schools and tell children that they might not be what their body is. So WPATH used a so-called consensus to develop so-called standards of care rules rather than citing studies. There's this whole "it's so rare" thing about detransition, and it's so rare thing about the entire diagnosis, which we're finding out is really made up because, for example, at PS 107 in Park Slope, Brooklyn, at various times in the recent past, the entire 5th grade class girls, not the entire, half of the 5th grade class girls identified themselves as trans or non-binary, in other words, not girls. Now that is social contagion, and there is a teacher there who is a woman but claims to be non-binary and is promoting this to these kids, and that is how all of this social contagion, that is the whole phenomenon. Okay, now Dr. Laffert continues. Proponents of gender affirmation care, including WPATH, make highly exaggerated claims concerning the lethality of gender dysphoria if it is not treated with this affirmation care. The number typically offered is something approaching 40% of mortality by suicide. Now, this is Uta here now, commenting. I think sometimes they conflate both completed suicides and so-called suicidal ideation, and suicidal ideation being something that is very common among several other, depression, several other conditions like depression, bipolar, and children who have experienced trauma. Okay. Dr. Laffert continues, there is no sufficient scientific evidence in the world literature that can be cited to support that claim. And in fact, the Swedish study, Cecilia Dana et al., 2014, Karolinska Institute, found out through the death records of deceased Swedes, where they age and socioeconomically matched non-trans post-op Swedes who had died with those who had changed their sex markers and had these operations. This was all a study done based on medical records, death records. The rate of suicide among males post-op males as compared to non-trans identified males in Sweden from the years 1973. Of these were males who had the surgeries between 1973 and 2003. The rate was 19 times higher in those males who were post-op trans, as they say, men ideating a female persona. Now, for the women, it was very shocking. 40 times higher for male-identified females, that is, females who ideate a male persona, who had had treatments such as having their breasts surgically removed. It was 40 times higher death by suicide compared to Swedes who were just regular sex and age-matched Swedes. And in fact, they were so careful, they both sex-matched and so-called gender-matched, and then they had this huge number. It was like 4,000 subjects in this study. And yet the WPATH claims that these brutal surgeries on your urinary tract will save your life. Now, the thing is, it's starting to look like anyone can tell who is in this claiming a different identity process. I was in a store just the other day and saw a woman who was my height. At the best of my measurements, I was 5'4.5", and she was almost morbidly obese, and she had a little beard around her chin, and I just glanced at her and then said to myself, okay, she thinks that she's a man, or she thinks that she's non-binary mask, and she's wearing pants. She's, clearly got a female shoulder to hips ratio, clearly has hands and feet that are the size of female, and you don't pass. That's the thing. Like, you just don't pass. And she looked, for a woman who is at least half my age, she looked very doughy and unfit, and that's not a good outcome. So thank you. Please share, like, and subscribe, and let me know if my sound was a little bit better with these new thingamajiggers.